Okay. So welcome everybody. Ralph Havens here with my good friend, Dr. Tom Giammatteo, a physical therapist, chiropractor, naturopath, what else? Acupuncturist, and developer of integrated manual therapy. And today we're going to talk about the over 40-year-old woman runner. Anybody can benefit from this, but we're gearing it towards women in their 40s and 50s and older runners dealing with some of the stuff that they're going through. And Tom's been the physician for, I believe, an Olympic team or some sort of national team. And and I've worked with a lot of runners here in Bellingham. Tom's on the East Coast. I'm on the West Coast. So Tom, thank you for taking the time. It's going to be an exciting time to talk to you about this. I've been seeing lots of women, and my wife is in a group with the local running store here that 50, 60 women run every Sunday, and a lot of them are over 40. And so I thought this could be a good talk. You know, there's all sorts of conditions that might be around that, fatigue or hormonal stuff, changes in the body like hair and even anxiety, depression, insomnia, of course, the running injury stuff, all sorts of things. What do you, when you think of a woman with, you know, a runner and 40, 50, 60-year-old woman, what are some of the concerns that you see, or what are the things that you see that pop up? What would you look at?
Well, the common injuries they come in for is plantar fasciitis or calcaneal heel spurs or gastroc tightnesses are generally some of the running things when people start to get back into running again. And running or any cardiovascular exercise is amazing and healing in itself. We should always try to check our diets to see how that influences the fuel that we put into our bodies at the same time. A lot of America is overstressed, and from the stress, we can have lack of digestion and inflexibility. So any aerobic exercise, any type of walking process and moving into running is just amazing to get back to nature in those processes. And then some indications that we may have this thing called adrenal stress, which is a gland in our body that sits above our kidneys, and it produces cortisol. And cortisol is important in the hormone chain to split off to be testosterone, progesterone, estrogens. And there are a couple non-laboratory ways you can actually test cholesterol in your body. And one of them is described by a Dr. Ragland even in the 1900s. So the cortisol is a stress hormone, they call it. And it's pretty famous that it helps with vascular control. So we can measure blood pressure in 3 different positions: lying down, sitting, and then standing immediately after each other. And if you have enough cortisol in your body, your blood pressure goes up every time you change your position. So if you had a blood pressure of 110 when you were lying down, when you sit up, it should jump to at least 120, and then it should jump up to 130. When you stand up, you take it one last time 2 minutes later, and it should go back down to 120 as your body accommodates the difference in gravity and stuff like that. That is a super healthy person with cortisol that's really there. What things eat up cortisol is sugar, bad foods, exhaustion, not getting enough sleep. And you know, we have 4 poisons that we don't like, that we consider food groups of no gluten or oats, no white sugar, no peanuts and almonds, all influence that whole process. So it's a really good perspective that we can do to see as we track our patients to getting healthier. We use the blood pressure system to show them that they are getting healthier. And this relates to chronic fatigue, this relates to bloating, this relates to migraine headaches, this relates to joint symptoms all over the body. So 90% of America is adrenal stressed and cortisol deficient.
Wow. So, and those are things that can be changed without even getting the manual therapy treatment or even supplements. Just
Yeah.
change diet a bit and just changing diet and some habits around sleep and things. And when somebody's already gluten-free and doing pretty good, but they're still dealing with some insomnia and lots of stress in life, and some that seem
Mhm.
able to have some of the stresses causing stress. But we talked earlier about the IMT for the diaphragms, and I'll leave some links about that.
Yeah.
But what else can be done? Like when you see somebody, a woman in her 40s, 50s, 60s, maybe she has some plantar fascia, maybe some bloating, some insomnia. You do the cortisol thing and with the blood pressure, and you start her on this process. And then what else would be useful, or how does that progress? Like, is that enough for most people, or do some
It changes a good 10 to 20%. They feel more energetic after that. We have a vitamin line or a supplement line, and we have a specific formula called GI Regen,
yeah.
which helps rebuild the GI system and also supports the adrenal system. And the main ingredients in there is called ashwagandha, which is an Indian herb that really helps repair kidneys and adrenals. And then the tribulus also helps bring up the hormones in the body as a natural process, and people feel more energetic and feel more. They have more extra energy during the day. They have better reserves, and when you get all those things, even your libido goes up sometimes. Hot
Yeah,
flashes go down.
yeah, um, and so I know you've recommended one in the morning, one at night. Are some people like a woman that's in like 100 pounds or 110, 20 pounds, would that still be like a twice a day, or would it be once a
Yep.
day
Um, Anybody over 80 pounds, that's our recommendation for that
recommendation?
whole
Okay.
process, right? And we even give children one tablet a day. So uh,
So
it's a pretty safe herbal recipe called GI Regen.
yeah, and you did
RE.
your doctorate program with that research on the tribulus.
Yep, yep.
Uh,
And so that rebuilds. We also use it for athletes that want to help rebuild muscle. So if you're running, you'd even take a tablet 20 minutes before you run, and you go running, and it helps rebuild the muscle patterns in the body. And then for marathon runners, we do have I do support some ultra marathoners that run 6 marathons in 6 days, to the regular normal 5K runner. And it can help actually put more sarcomeres and more muscle mass on their bodies just using that herb at the same
so
time.
just doing it as a regular thing would help, and also part of your pre-race routine to take one.
Yep.
With the world-class guys that get drug tested, any chance they would get positive testing for steroids or some sort of like problem that shows up in the blood?
So far, they're not on, none of those herbs are on the national registry for Olympic
Because
chemistry.
that's like very particular. Some of those guys.
I've had those questions before.
Okay,
So,
okay. Good to know. Good to know. Because there's actually a
that's
world record holder here in a couple of them that I know. And so and they can get tested. So that's good to know.
Yeah, so the last time I was asked that was last year, and so far I do not know from the 2024 list that none of these herbs and the combinations create anything that can be found in a drug
Okay,
test.
cool. And it's they're listed on the ingredients, and you can check for yourself as well.
Right.
So for the woman that's it seems to be a talked about issue, the 40, 50, 60-year-old women going through these changes that happen, um, the hormonal changes, the like you said, bloating, some of the physical things,
Yeah.
but also just anxiety and depression. And so that looks like a pretty simple um solution. So GI regen and the diet and
Would be the most amazing thing in the world. You know, our ultimate integrated manual therapy really looks at what is your optimum health.
yeah,
We have a lot of people that are sick, and even sick throughout their whole life. And I tell people if you need to take over the counter things more than once every 3 months, then you're covering up some of your symptoms. And our ideal woman's health is you menstruate without PMS all the way up into your 50s and 60, being 60 years old. That should be the natural flow. And when it decreases before that time, it was overused, overworked. And again, Western medicine just puts drugs in and doesn't care about the past or the forwardness of that. So, a lot of people in the 40s, 50s, and 60s even use birth control as an oral medication. And nobody really talks about the consequences and how much that burns out the organ systems during those times. It keeps you from getting pregnant, or some people were using it just to control their PMS or control
Yeah.
muscle cramps. Those that's like throwing an atomic bomb in the middle of your body, and it just shuts it off and puts it away, but you never really went back to the causes of it. So we in our women's health program start at, we want to look at a female generally in a healthy nutritional status. They start menstruating between 12 and 14 years old. And they just one day wake up and they have their menstrual cycle. That is the optimal woman. And in our infertility to fertility program, we get women that, had endometriosis, cramps, multiple surgeries, and we get them to that cycle before we say, okay, it's okay to get pregnant again, right? So we
So,
want that as an indication of those pieces. If you suffered with those, if you suffered with continuous acne, if you have a low thyroid, you were sick when those even got diagnosed. So, but the body is very adaptable, and it's like a plant that's sick in the corner. If you nurture it the right way, put the right supplements in at the right time, that can all be reversed in those whole processes. So the ideal person should be, waking up, having the menstrual cycle during the lunar phases appropriately. And if that's not happening, then we go back and ask, well, what hormones are off? We don't chase the hormones. We ask, well, what in the system? And the anxiety and the depression actually come 45, 50% from gut health, right?
yeah.
We produce all our neurotransmitters there. So you're just compounding things in the body. And nobody in Western medicine talks about the liver being a factory that has to do over 500 chemistries in a day. And we really look at that in a structural way. We look at that in a nutritional way. And the liver is responsible to convert all your hormones up and down the chain. And nobody says, well, you need more nettles, you need more green tea, you got to stop eating the fructose and stuff in there that sort of poisons that. Another big thing a lot of people are getting diagnosed with is fatty liver,
Yeah.
right? Some of it could be postural, some of it could be the hormones in our food. So there's a lot of things that can help somebody run better, run faster. And we sometimes use orthotics in that mix just to get them over the hump until we get them healthy again. Right.
Yeah. And you're kind of haven't even talked about a significant part of your work, my work, our work, the integrated manual therapy hands-on techniques. I did I think 5 runners with pre and post session filming of their running,
Yeah.
and they improved a lot. And it was just wonderful. I've got it on our YouTube, and doing the hands-on, you taught me the helix biomechanics for the pelvis, and we talked about the diaphragms. I did the diaphragms and descended phenomena. There's hands-on techniques that even speed this along, because what you've described so far is, man, you just change your diet and take one supplement with some tribulus and ashwagandha and some other things, and you really start to improve. So that can do a lot. Just and we're talking, but then when somebody's got diagnoses like the thyroid and the endometriosis and maybe the cysts that come up in the body and all sorts of other things, and maybe some liver things and chronic fatigue. Anything you want to say about the hands-on approach, the integrated
Yeah.
therapy approach to this?
Well, we talked about how our sports medicine program, and I hope you're going to be able to offer this up in your network, is to learn how to do these rebalancing of muscles, right? You're running on the street and you hit something and your leg slips out, and then the next day your back of your leg is tight. And we have some techniques that can reboot that every time. And we've gone to professional teams and we've gone to college and university teams where they put in this reset program called Advanced Strain Counter Strain. And it reboots. We had a ballet uh, instructor from Yale who ran the Yale ballet team, and they actually put this in for 3 months, and they gained 7 inches of hamstring stretch.
Nice. So that is something I'm going to put links to, and reach out to me, reach out to Tom. because there's a process called advanced strain counter strain for the diaphragms, the pelvis, the respiratory diaphragm, the thoracic inlet, the cranial diaphragm, the area under the collarbones that resets this system. And it is something you can learn to do in a partner kind of situation. You do it to your partner, they do it to you. It takes 10 or 15 minutes per person. And we'll put some links out there, and I'll share this with the running store and that running group. And that'd be a really nice way to treat each other.
Yes. So yeah, everybody's an individual. Everybody can benefit from some of these tools. Some people benefit from one better than the other. And that's where our specificity comes in. If you come and get an evaluation from us and just say, oh, your arch is dropped, let's give you an orthotic, or no, you need a diet, or nope, we got to get your pelvis open, or nope, it's coming from your shoulder blade. So if you really want to keep your activity of health up of running and not feel pain, we optimize that for people. And
That is the IMT approach. We're like rehab, like let's help somebody heal up something that's a problem right now. But then it's also the performance, the optimization performance, like you said, for the runners that want to perform really well. I work on my little boy 3 or 4 times a week, just to optimize his performance. And every so often there'll be a little niggle, a little pain that shows up, and we help that out and fix it up. But yeah, so reach out to Tom. I'm going to give you his contact information everywhere, but let me just grab it. And it's imtwellnesscenter.com in West Hartford, Connecticut. And you can reach him at imtwellnesscenter.com. His phone number is 860-561-2286. Try these recommendations out if you like. Reach out to him, reach out to me, Ralph Havens, here in Bellingham, Washington, ralphhavens.com, and 360-599-2217. I'll put links for all of this stuff. And if you want that reset for yourself and to learn that for your team or your friends, or your friend, you and your friend could do it to each other, reach out to us and we'll let you know how to get that going. So Tom, this has been great. I've been running into lots of women, and like I said, my wife's in that running group now with 50 or 60 women. And there's a lot of these kind of things coming up, whether somebody's dealing with fatigue or insomnia or thyroid or the endometriosis stuff. And of course, the plantar fasciitis does seem to be a thing, and pelvic stuff and all sorts of things that we can help. And you gave some great resources that are things you could just start doing now. And then I'll put the link to the IMT Wellness Center store and get the GI Regen link there. And there's a coupon code there for you if you want 10% off. And anything else you want to say to the women of the world, the runner women of the world?
I think it's an awesome idea that everybody starts movement, and running is a good, easy, convenient way. And if you're having some muscle skeletal issues in that whole process, they can be simply reduced and hopefully don't hurt yourself. And check Ralph out if you're in the area and somebody's asking to do surgery on you instead of that area.
Yeah, we actually have some great success stories about that with some runners and some other people, some walkers. Well, thank you, Tom. I'll go ahead and click
Thank you,
all,
Ralph.
and let me just go here.